title of this tutorial is the brachial plexus. This is the first part of two. My name is Carlos Andres Suarez Quian and I will be the narrator. This tutorial was produced while on sabbatical leave in the laboratory of Dr. Manuel Eugenio Dorado Ocaña, Associate Professor in the Department of Anatomy and Embryology at the University of Sevilla, Spain. This tutorial is solely for educational purposes and is not meant for reproduction, posting on the web, or to be used for commercial purposes. Let's begin. The brachial plexus is the system of nerves that forms in the posterior triangle of the neck, that travels to the axilla, and innervates all but one muscle that move the upper limb. There are two objectives in this tutorial. First, I will describe the relationship of the brachial plexus to the axilla and the posterior triangle of the neck. This will comprise the first part of this tutorial. In the second part of this tutorial, I will describe the brachial plexus itself and go into the details of the nerves that make up the brachial plexus. Let's begin with Objective 1. What are the axilla and the posterior triangle of the neck? It may seem perplexing to begin a tutorial on nerves by first describing the anatomical regions in which the nerves are found, but because these regions are complex and of clinical relevance, it is important to define these regions first before describing the content of the brachial plexus. Look at the skeleton of the upper right chest. Note that the humerus is partially abducted. The axilla is a four-sided pyramid that extends from the armpit to the neck. Let's put a four-sided pyramid in the figure to better define the space of the axilla. Now that we have defined the space, we need to describe its borders, the walls that make up the axilla. Given that the space is a four-sided pyramid, clearly we need to define four walls, but also a pyramid must have a base. And to put the base of the pyramid in practical terms, the base of the axilla is the skin of your armpit. If you put the palm of your hand on your armpit, you are approximately at the base of the pyramid indicated in the image. The pyramid also has an apex. Put your finger just behind the clavicle where you can feel a depression on your neck. This is the approximate region indicated by the apex of the axilla in the image. And now we describe the four walls. There's an anterior wall, a posterior wall, a medial wall, and finally a lateral wall. Let's now look at the space defined by these walls as well as the muscles and bones that define the walls. An ideal way to examine the axillary space is to make an axial cut through the axilla and then examine the section of the image. This is schematically indicated in this image. Shown in the slide is the resulting image of an axial section of the axilla made at the approximate level indicated in the upper left-hand image. The section is placed using the conventional orientation used to present axial images. Anterior structures are located superiorly on the slide. Posterior structures appear inferiorly. Images on the right side of the body face you on the left side of the slide, and images on the left side of the body face you on the right side of the slide. Let's now define the axillary space, and as the image indicates, this is a real space. In fact, it can easily contain a couple of liters of fat in a large person. Remember, the axillary space extends from its base, that is your armpit, to the upper plane defined by the clavicle. Take a moment to define this space in yourself. In the average person, this space can extend nearly half a foot, so the assertion that the axilla may contain a liter of fat should not be too far-fetched for you to accept. Now we can define its walls. Anteriorly, two muscles make up its anterior walls. the pectoralis major and the pectoralis minor. Posteriorly, muscles and bones make up the posterior wall. Muscles include the teres major and latissimus dorsi, and as you move towards the midline, the scapula and the subscapularis muscle finish up making up the posterior wall. Medially, the ribs and the serratus anterior muscle make up the medial wall. And finally, the lateral wall is quite narrow. It is made up simply by the bicipital groove of the humerus. So this is the axillary space and its borders. Let's now look at the actual dissection of the axilla. On the left side, we have a female cadaver whose skin of the axilla has been removed, exposing the base of the pyramid. Take a moment to become oriented. Note some of the muscles we mentioned in the previous slide. A muscle that contributes to the anterior wall is the pectoralis major. A muscle of the posterior wall, the latissimus dorsi, is evident. Only the inferior part of the serratus anterior can be observed, a muscle of the medial wall, but its upper fibers are masked by the axillary fat pad, a major component of the axillary space. On the right side, a different cadaver further along in its dissection of the axilla. The pectoralis major and minor are reflected and some of the axillary fat pad removed. Now we can see some of the contents of the axilla. The axillary artery and vein are apparent. The brachial plexus is still embedded within the fat. The axillary dissection was continued and all fat removed to expose the content of the axilla. Muscles we described previously that make up the walls of the axilla are evident, including the serratus anterior, subscapularis, and latissimus dorsi. Of course, to expose the axilla, the pectoralis major and minor were reflected. We now add the axillary pyramid to the image to define the space of the axilla. Consider for a moment the walls that make up the axilla, and now look at the major nerves found in this area. This is the brachial plexus, the nerve plexus that innervates all the muscles except one of the upper limb. We will define the brachial plexus in the second part of this tutorial. Now that we know the location and boundaries of the axilla and its content, we need to discuss how the nerves and vessels of the axilla get there, and they do so from the posterior triangle of the neck. This too is a space that can be easily defined as shown in this slide. The anterior wall of the posterior triangle of the neck is the posterior border of the sternocleidomastoid muscle. Turn your head to the left and define this muscle on the right side of your neck. The posterior border of the triangle is the anterior border of the trapezius muscle. The base of the triangle is formed by the middle third of the clavicle. After removing the skin overlying the posterior triangle of the neck, we expose its contents. Yes, the image is complicated. Don't despair now. We will spend quite a bit of time during the head and neck and study this region in detail. At this point, we're simply describing the beginning of the brachial plexus in relation to the anatomical boundary of the posterior triangle of the neck as it relates to the axilla. Stop the tutorial for a moment and examine the labeled structures. The sternocleidomastoid was reflected anteriorly to better demonstrate the contents of the triangle. Look for the scalene anterior and middle scalene muscles. These two muscles define a triangle through which large nerves and one large artery exit into the posterior triangle of the neck on their transit into the axilla. The nerves represent the trunks of the brachial plexus. The artery is the axillary artery. It changes its name from subclavian artery once it crosses the first rib. One aside of this image, there is a variation in this dissection that I should mention to clarify the situation for beginning students. The scalene anterior is split in this example by the upper trunks. Generally, all trunks of the brachial plexus enter the posterior triangle of the neck, posterior to the scalene anterior. Now think of what would happen if the scalene triangle were to narrow. Want to know the answer? Look it up. In the previous slide, we mentioned the trunks of the brachial plexus. What are they? They represent the ventral rami. Rami is plural of ramus, of spinal nerves. The ventral rami spinal nerves C5 to T1 give rise to the trunks of the brachial plexus. The upper two rami will give rise to the upper trunk. The C7 ramus will continue as the middle trunk, and the C8 and T1 rami will continue into the lower trunk. All this may appear confusing now, but will become clearer in the part 2 of this tutorial. In addition, in the previous slide, the individual rami trunks were difficult to distinguish. Indeed, that is how they often appear in a dissection, and students are often at a loss how to identify the individual rami and trunks. In this dissection, I carefully separated the rami and trunks and kept them separate to photograph. Do not expect your own dissections to look this way unless you tease apart the individual rami and trunks and pin them down to keep them apart. As a review of what is the root, ramus, and spinal nerve, take a look at the image in this slide. Remember, nerves exit from the spinal cord, shown in cross-section here, as the dorsal and ventral root. They come together as a spinal nerve that exits the spinal canal via the intervertebral foramen. Almost immediately, the spinal nerve splits into a dorsal ramus and a much longer ventral ramus. As mentioned previously, the roots of the brachial plexus represent the ventral rami of the C5 to T1 spinal nerves. So here's another question you need to answer. What deficits would you encounter if you have an injury to a root versus a ramus? A last piece of the puzzle of what makes up the brachial plexus is shown in this slide. When anatomists look at a dissected spinal cord, shown in situ in the image on the left, two enlargements are readily apparent, the cervical and lumbar enlargements. What are they? The cervical enlargement corresponds to the attachments of the large nerves that supply the upper limbs. The lumbar enlargement serves the same function for the lower limb. Look at the image on the right. The enlargement extends from about the fifth cervical to the first thoracic vertebrae. The reason behind the enlargement of the cervical region is because of the increased neural input and output to the upper limbs that we will describe in the subsequent portion of this tutorial. Again, focus on the dissection on the right. Understand that we're looking at it from the dorsal side. Hence, we do not see ventral rami, only dorsal ones. This now concludes the first part of this tutorial. In the next part, we will describe the actual brachial plexus. We wish to acknowledge the donors whose gift of their bodies for medical education made this work possible. I am humbled by their humane gift. Special thanks must go to Mr. Mark Savonia, who does the incredible work of embalming the cadavers. His skill is obvious in the images. Thank you. Finally, you can use your QR reader to look in Apple iBooks, where you will find flashcards, ID questions, and higher order problem-based questions relevant to this tutorial.